So thank you everybody for coming to our bi-weekly COVID-19 meetup and check-in. My name is Amelia, and today we actually kind of have a pretty full agenda, I think. So we're going to start with our 3 deep breaths. We're going to talk about the governor's directive that was issued on I don't think it was the 19th. Was it the 17th? I think it was on the 17th. But the most recent one, see if there's any questions about that. We're going to talk about the Montana COVID-19 vaccination plan coordination team, which was just announced this morning, I believe. We have a few notes from fall workshops. There was a relevant discussion about the mask policies in the self-care and wellness session. Then we're going to do a vaccine news and check-in with Pfizer, Moderna, and AstraZeneca. And then we have some information about the Montana Shared Catalog app, which is very exciting. And then we'll end with our 3 deep breaths. Of course, at any point in time, if you have any questions or comments, please do put those into the chat box, or feel free to unmute yourself, and I'll bring it up to the group so we don't have to stick to just this agenda. But these are the things that we are planning on covering for sure. So we'll start with our 3 deep breaths, and I put a picture of pumpkin pie because pumpkin pie is a beautiful thing, but maybe you're not a pie person. So if you just want to think about also your favorite kind of dessert, you can put something into the chat box afterwards so that we have delicious things to contemplate and salivate over. But if we want to go ahead and get set up for our 3 deep breaths, just sit wherever you are, or stand if you're standing. Try and open up your chest, bring your shoulders down. Pretend someone has attached a piece of string to your sternum and it's just gently pulling upwards. And really kind of open up your diaphragm and lower belly. And try and send your breath down there. And we'll do our 3 deep breaths. So inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Excellent. And I see that Velociraptor Prime has said that pecan pie is their favorite. Um, so just a quick review, the governor's directive that was released on I kept on saying the 19th. I guess it was the 19th. I don't know. Someone feel free to fact check me on that. I thought for sure it was on the 17th. But this new guidance will take effect on the 20th, which was on Friday. So this is just a social media graphic that was released to kind of explain the new directive. And so the main things are that masks are required in all counties, regardless of case numbers. Previously, if you had less than 4 active cases, you didn't have to have a mask requirement. Public gatherings are limited to 25 people when social distancing is not observed or possible. And then bars, casinos, and restaurants to operate at 50% capacity and close by 10 p.m. So that does definitely affect definitely businesses and some other things in the community. And so they do have the social media graphic on the COVID-19 webpage in case you need to share that out. And I will also put into the chat box the link to the directive if anyone needs to take a look at that. And that has more details. But just wanted to make sure everyone was aware of that and see if there were any questions. So let me go ahead and find the directive link and see if there are any questions coming into the chat box. And there's going to be a lot of links in the chat box today, just to let you know. So as a reminder, you can save the chat and save the transcript. And I'll also include all the links in the Vimeo description when I send out the recording. Okay, if there aren't any questions, we'll go ahead and move on. And this next slide is to talk about the Montana COVID Vaccination Plan Coordination Team, which, as I said, was announced this morning, and Jenny will be talking a little bit more about that. And I will also drop the vaccination plan itself into the chat box if you'd like to take a look at that.
Great. And Amelia, I think I did just drop the plan in there.
Oh, okay, great. Perfect. Thanks, Jenny.
Yeah. So I want to caveat all of this information with this information I'm going to share is the best available information based on my understanding of the process at this point. I have an email into the woman who's coordinating the state's vaccination plan and who's heading up the vaccination plan team that was just announced today, and they held their first meeting today. So this plan was created, it was a requirement by the federal government that each state submit a vaccination plan to help the federal government coordinate vaccination disbursement and to make sure that states are thinking about how best, most effectively to distribute vaccinations. So the plan was submitted to the feds in mid-October, and then this team was announced today, and they met today. It's a multi-sector team with people from across state and local government, as well as the education, business sectors, a variety of representation, a fairly large team. Connie had reached out to me asking what we knew about where libraries might fall in priority for access to the vaccinations and what, if any, opportunity we have to advocate for librarians. So the plan itself, when you look at it, is very dense. And what it seems to convey is that this team will be responsible for identifying priorities based on populations who should receive the plan. I'll go ahead and maybe share my screen. If that's all right with you, Amelia, I don't want to screw you up too much.
Yeah, go for it.
And then what I'm sharing is the vaccination plan that I put in the chat box. So you should all be able to have access to the plan through the link. And what I will draw to your attention, I hope, is on page 11 and 12. It's these tiers of populations that are used to prioritize how the vaccinations might be distributed. So my understanding is this team will identify large populations like those who might be at most risk and estimate the number of people in those populations in order to determine how many vaccines should be distributed to local governments to meet the needs of these overall populations. And then DPHHS will be working with local health jurisdictions to identify actual personnel or individuals within those populations within a community that meet the criteria identified in these tiers. So for example, you see tier 1 is that critical infrastructure. This team might say that the critical infrastructure includes government employees, but a local health jurisdiction might refine that to say emergency health workers, other kinds of frontline health professionals, and so forth. So there's a little bit of scaling involved with identifying those populations at a high level and then allowing local jurisdictions to identify individuals within an individual local jurisdiction. And you can see that the plan goes on to further identify in tier 1 who might be considered within that tier 1. If you follow some of the links within the document, there's a couple of places where libraries might be considered. The first one is within this identifying critical infrastructure document, which was something that was produced by the federal government, and it does identify government facilities as critical infrastructure and includes libraries in that list of government facilities. And then within tier 3, people at risk of acquiring or transmitting COVID is where you find educational services like schools, university settings, early childhood care centers, and so forth. So although libraries are not specifically called out in that area, it's also likely that libraries would be considered in that educational group. Connie has done some reaching out to a local health official in her area, and he has indicated that it's likely that libraries would fall in that educational area. But he also reiterated that that doesn't necessarily mean there might be a long wait time, and it shouldn't be viewed as deprioritizing those categories of population in these subsequent tiers. That's not what they're intended to convey. This is intended to convey an easy and effective distribution model for those vaccines. So that's sort of what we know at a high level. I have reached out to the woman who's responsible for this plan and asked how we might best engage with this team so that they are well informed about library services and how library services are being impacted by the pandemic, and how access to vaccinations for library staff would help continue, would allow libraries to continue to support our communities during the pandemic. Some things that we're wanting to convey is just the number of people who visit libraries on a daily basis and the roles that libraries are playing to support persons experiencing homelessness who are disproportionately impacted by the pandemic, people who are using libraries to access online learning materials like homeschool families, libraries that are serving as telehealth offices for patrons accessing telehealth resources, and so forth. The local professional that Connie engaged with did offer to meet with us, and it would be really helpful for us, I think, to understand what kinds of questions you might have that you're thinking about when thinking about accessing access to the vaccine, and as the state is planning, so that we know what kinds of questions we might ask of him, as well as the state officials who are responsible for the overall plan for the state. So that's the information I know right now that we have to date. It's great that we have this contact in Flathead County, so thanks to Connie for asking the good questions and making those connections. And I would really encourage you to either share questions you have now in the chat or follow up with Amelia or your consultants with other specific questions that we can then ask as we work to engage with this team to better understand what this process is going to look like.
And Jenny, there's a couple questions already in the chat to consider. So one from Susie: does the plan speak to guidance for staff who do not want to be vaccinated? And I'm guessing, other people are probably wondering that in other sectors as well. And then Jennifer asked, are they having a mass vaccination, or will one have to go to their doctor? So yeah, where exactly the vaccine will be delivered.
To Susie's question, I do not recall that the plan addressed people who don't want to get vaccinated. So I don't know that, but that'll be a good question for us to follow up on. To the second question about where people will be vaccinated, the plan does go into quite a bit of detail about what is necessary for a facility to be able to offer the vaccine, including trained professionals, as well as appropriate storage facilities, refrigerated storage facilities to store the vaccine. So every indication from the plan is that it will need to be in a place that can properly administer the vaccine, like a healthcare facility. I haven't seen any indication of any kind of mass vaccinations.
I don't know with the temperature criteria, but we did have health department staff say that, Jennifer, at the fairgrounds, the mass like drive-through flu vaccine situation they had this last fall was a dry run for the vaccine coming up. So that obviously might change, as Jenny's saying, with the criteria, if they have the right things they can take there. But I mean, -70 is really low temperature for that.
Mhm.
Yeah.
So.
I think at this point, it's safe to say there's probably more questions than answers. But I wanted to make sure you had access to the information that we had at this point. And like I said, if you have specific questions that can help us make more informed discussions with these officials, we appreciate that.
And as Jenny said, please do email me or the consultants with any questions that you have, and we'll be sure to pass them on to Jenny. And I'm sure as information comes out and changes, Jenny will probably be back on the call to update us all and let us know. And Jennifer asked, is there only one emergency authorized vaccine right now? And there actually is not yet an emergency authorized vaccine as far as I know. We're going to talk a little bit more about vaccines later on. Obviously that information is changing a lot as a lot of things come out, but nothing has been approved so far.
All right, that's it for me. Thanks, Amelia.
Yeah, no worries. And I did, just to let people know, I did mute some people earlier because there was some background noise that I was hearing. So if you're talking and no one's acting like they can hear you, that might be why. So just chat me and I can unmute you in case you want to talk, or feel free to put stuff into the chat box. But I don't want anyone to feel like I'm ignoring you. So let me go ahead and reshare my screen. And the next thing is, I'm sorry for this big long wall of text, but this is just some notes from the mask policy discussion that happened at fall workshops during the self-care and wellness session. So I think this was passed along to me and people found it really helpful to just kind of talk through and, you know, just understand a little bit more of where we all are at in terms of our jobs to kind of enforce these policies, and where people are in terms of the myriad of reasons why they may or may not want to wear a mask. So I think I'm not going to read through all of this, but a couple things that I wanted to bring your attention to is realizing that a lot of people are scared, I guess. I think fear is, I think, a very real, very visceral emotion. And even though people aren't necessarily acting scared with you, maybe it's coming off more as angry or annoyed or whatever other emotion. I think a lot of it is traced back to fear. And I think that That doesn't necessarily excuse some behavior, but can kind of explain some behavior. And I think we all know how difficult it can be to ignore that feeling of fear. So just keeping that in mind. I bolded and italicized the install a doorbell and keep the conflict outside. This is being done by Hot Springs because I think that, I know that's not obviously a feasible action for everybody, but if that's something that you're thinking about doing, maybe that could work and sidestep the whole thing. So just this is just here to kind of remind you all that you aren't alone in this struggle with mask policies. There's been a lot of instances in libraries all over the state and probably all over the country regarding different beliefs of personal safety and different views on the pandemic. And so this is just to sort of help us all address these issues when they come up, and kind of make sure that we're also kind of taking care of ourselves too. If anyone else who was at this discussion and would like to chime in, feel free to. But again, these were just some of the main takeaways. So we just wanted to make sure to share them with you all.
I found the last one, place the signage, kind of interesting. It was the presenter, Karin, who suggested that. And she kind of talked about how, with the stress of the pandemic, we'll get irritated more easily. And so when you place the signage farther out, then it reminds people, which, you might say, well, you should know, but we have a lot on our minds. And she said, so you see that sign, you're not very far from your car or whatever, and you can go get your mask. And it also just prepares you. And I thought that was like a very simple solution, and that her explanation for why it can help was a good one.
Great. Thanks, Tracy. That is a
Yeah.
good point. And Susie said in the chat that we started a Thanks for Being a Hero program today at the library. We used some of our CARES funding to buy $5 downtown gift cards. We are publicly rewarding random people each day for wearing their masks correctly, trying to celebrate the majority of people who are wearing their masks correctly. And that's a really great idea. Plus, it's helping to support downtown, which is great. And Connie just posted, has anyone else looked into nonviolent communication for guidance? And then she posted a link. So I have not heard of this, Connie, if you would like to elaborate. But if anyone else has heard of this, feel free to respond.
So nonviolent communication, I feel like I've been thinking about that for years, but it takes, I think, like a lifelong practice. But the concept, like other things that are Zen-like, but it's the concept that no matter what someone is expressing, and you may not agree with it or even feel like it's validated, but everyone's expressing a basic human need. And so we've talked about this in trying to not become or overly personalize the mask issue. I think people, when you're talking about fear, there are some other things too, like everyone has the basic need for independence, autonomy, safety, all these things that are listed in the link I shared. And so I think it's been helpful to think of it in that way too. Like, what basic need is this person expressing that's not being met? And it's not even maybe your job to meet it, but it kind of humanizes people in a way that takes away the personality, takes away the anger some.
That makes sense. Thanks, Connie, for sharing. I hadn't heard of that. So I'll take a look at that link later on. Any other questions or comments about mask policy discussions or anything like that? If anyone does install a doorbell, just sending out a plug for like putting a fun doorbell chime, like the Macarena or something like that. I always find that charming when people have fun tunes. Okay, so the next thing that we're going to talk about is a vaccine news check-in. And before I start talking about this, I'm going to drop all these links into the chat box. There's a lot of them, and there's even more if you do more searching online. Oh, it won't even let me paste these. So I might have to drop these in after I finish talking. But this was just a selection of articles and news things that I found over the past few days. I searched for these this morning, so things might have changed already. And I'll try and provide an update at each of our check-ins just to let you know what's going on. But I wanted to go over a few main things regarding vaccines, who's been coming out with great looking potential vaccines, and what the conversation around those things are. And if anyone else has information to contribute, please do feel free to put that into the chat box and let us all know. But again, all of this is very, very subject to change. There's a lot happening right now, and it's moving very fast. So the first thing I wanted to cover is, what exactly does emergency use of a vaccine mean? That's been a lot of news things talking about the FDA granting emergency use approval for vaccines. So emergency use of that vaccine means that the authorizing or regulating bodies, in this case the FDA for the United States, allow shots to be given to certain people while studies of safety and effectiveness are still ongoing. So typically with vaccines, it usually takes about a decade for FDA approval. It's a pretty rigorous process. It requires a lot of safety checks, a lot of clinical studies, a lot of blind testing, all of that. But because we find ourselves in extraordinary circumstances, in such circumstances, the FDA can loosen standards to allow for experimental drugs, devices, research, vaccines, etc. So in this instance, even though a lot of these companies who have released their initial data that seems very promising, they are still planning to continue with their clinical trials and safety things and testing the effectiveness. But while that's still ongoing, the emergency use allows them to administer the vaccine as well. So obviously, this does not mean that there is no risk involved. With anything, there is no 100% effective guarantee. It's a constant balance of weighing the benefits versus the risk. And in this case, and in other cases that emergency use of whatever has been granted, it's because the benefits outweigh the risks. And I also just, there hasn't been as much conversation about this, but just something that I've been thinking about as well, with the conversation around vaccines and how certain populations don't necessarily trust in vaccines because of, there are some very real side effects that can happen with vaccines, although it's been proven to be a very, very, very small subset of people. It's important to emphasize that with anything, not just health stuff, with anything that you do, there is no 100% guarantee. And so I think in general, people are trying to be mindful, I think, of the conversation around the COVID vaccine because, you know, just because emergency use approval is being granted, it does not mean that there won't be any side effects. But just because there are side effects does not negate the overall effectiveness of something. And there's side effects for everything. So just to kind of further contextualize that. Let's see. Another thing to kind of update you on is, who are the main players in the vaccine producers? I think last time we talked about Pfizer and BioNTech. They had just come out with their early vaccine trial information. But now there's been other players who have entered. So the three main groups that have come out so far are Pfizer, BioNTech, which is a New York and Munich partnership. Their initial COVID data had 95% effectiveness. Moderna, which is based in Cambridge, had a 94% effectiveness. And then the most recent one is AstraZeneca, which is UK based, and their effectiveness is reported at 70%, but it's important to realize that that is an average of 2 different trials. So in the first trial, they had the regimen 1 of dosing. So it was 2 full doses of the vaccine a month apart, and that was 62% effective. And then they did a second trial, which had a different dosage regimen, which was a half dose followed by a full dose a month later, and that had a 90% effectiveness. So if you see 70% with AstraZeneca, it's because they averaged those two together. So both Pfizer and Moderna use mRNA technology in their vaccine. So it's kind of mimicking the proteins, and I don't know exactly what's going on there, but it's using the proteins on the surface of the COVID virus to sort of jumpstart your immune system and produce the antibodies needed. It's unclear what AstraZeneca uses. I'm guessing it's probably mRNA technology. That seems to be what's mentioned most in regards to COVID vaccine research. But I'll see if I can find more about that. And then it talked a little bit about the clinical trials that Pfizer and Moderna use. So they recruited a pretty diverse group of people for both of those clinical trials. So lots of people of color, lots of people who were 65 plus, lots of people who had high risk chronic diseases, so that they had a large swath of all kinds of people to see how different groups might react to the vaccine. So those are the main players right now. I would not be surprised if more companies come out with potential vaccines, and we'll keep you updated on that, but that's what's going on for right now. In terms of the timeline of stuff, so Pfizer, which was the first company to come out with COVID vaccine data, they applied for emergency use authorization from the FDA on November 20th. Moderna will probably apply for this emergency use authorization as well. It's unclear when they're going to do it, but I'm pretty sure it's going to be soon. Companies can only apply for the EUA, which is the emergency use authorization, when half of the trial participants have been followed for 2 months after their last dose. So I think Pfizer did a clinical trial with like 43,000 people. Moderna did it with 30,000 people. And they both, Pfizer has already reached that threshold, and Moderna is quickly approaching that, I believe. You don't have to, I think the FDA can grant EUA to multiple companies. And I think in order to meet demand across the states and across the world, there are going to be multiple companies manufacturing and distributing vaccines. So it's not like a Pfizer got it and that's it. They're the only ones who can make the vaccine. There's going to be multiple companies that are offering this vaccine, I'm guessing. So the FDA has announced that its vaccine advisory committee will meet on December 10th. And at that point, they will assess Pfizer and probably Moderna's data and decide if the vaccines are safe and effective enough for restricted use. So from what I read so far, most researchers and experts are expecting that the authorizations will be granted. If the EUA is approved for whatever company and provider, the CDC will appoint a committee to determine which groups should be first in line for vaccination. There hasn't really been much more detail about that beyond that. So I'm guessing once the committee is appointed, more details will be coming, and they'll be working more closely with distribution chains to figure that all out. So Pfizer and BioNTech had sent out a press release, I think on the 18th, and it has a summary of their final analysis of their clinical trial data. So their vaccine was shown to be 95% effective against COVID, which is actually an improvement over the 90% that was earlier reported. So that's one of the links that's included here. I haven't found a similar thing for Moderna or AstraZeneca. There might be something forthcoming with sort of like a bird's eye summary of their data. But Pfizer is the only one that I could find for right now. Let's see, other things to mention, storage and transportation. So the Pfizer vaccine requires super special ultra cold freezer container thingies because the vaccine needs to be kept at a temperature of negative 94 degrees Fahrenheit, which is pretty cold. So that kind of produces some distribution and logistical challenges. The Moderna vaccine requires a freezer as well, but just at 25 degrees Fahrenheit. And the vaccine will remain potent for up to 30 days at normal refrigerated temperatures. I think the Pfizer one is a little bit more persnickety in terms of refrigeration too. So that's kind of a challenge. In terms of like distributing things, I think the States actually has a pretty good system set up. There's already designated distribution centers and states, and then from there on, it goes out to counties. So if it were like a regular thing, it could be distributed pretty quickly, but it's because of this refrigeration aspect that's a little bit more difficult because some of these centers don't necessarily have the necessary required freezers, and then some of the healthcare places themselves don't have negative 94 degree temperature capabilities. So that's something that they are working on. The AstraZeneca vaccine does not need to be stored at freezer temperatures, so it could be potentially easier to distribute, especially in developing countries. But again, this is all a wibbly wobbly developing ball of stuff. So we'll get more details as more information comes out. But just to let you know that distribution might be a little bit more challenging because of the refrigeration aspect. I see that Nancy has put some numbers in the chat. So I don't know if you were trying to put a question in, but there's
Looks
another
like
question.
a barcode.
Oh, okay. Thank you. And then Jennifer asked, how long out of the freezer can Pfizer be? And that is still, I think, being determined. I think the answer is not long. I think it is very sensitive to temperature changes. And the last thing to kind of consider and chew on is just what the effects of the emergency use approval on vaccine studies will be. So this is more just like a philosophical kind of question of ethics. Because if a vaccine is made available, the question is whether or not to let placebo folks in the clinical trials take the vaccine or not. So a lot of trial participants have said that if they were told that they were in the placebo group, they would ask to get the vaccine if they were available. And a lot of people volunteered to be in the trial because they wanted a vaccine to be available. So the reason why this can affect vaccine studies is because it can really affect the study of long-term effects, which is a crucial part of data collection and analysis of the effectiveness of vaccines. This could also potentially affect other clinical trials that are happening that aren't COVID related, maybe for a new drug for like heart disease or for cancer, or for whatever, because with a lot of clinical trials, you're not supposed to be taking anything else that can potentially interact with the thing they're trying to test. So this is just something that researchers and public health specialists are considering. So I just thought I'd bring it up to kind of, further contextualize this conversation and realize that other things can be affected. I think in most cases, many people have said that they probably would give people the vaccine, but that would just also make it more challenging to get results on the vaccine themselves. So again, I will drop all of these things into the chat box, and there's a lot of other articles that you can read about this, and there's a lot of new information that's being written constantly. So we'll probably do another check-in and update about this in 2 weeks, but just wanted to see if there are any questions now, and hopefully I covered most of the questions that you might have about the vaccine so far. And Jennifer said, yes, because it can't go into a person at that cold of a temperature. Yes, and so I think what I read is that when you take it out of the special, they call it the pizza box freezer, I don't know why it's called that. It can only be out of the freezer for like a minute or two or something like that before it has to go into like another like refrigerated thing. I'm not really sure how that works in terms of it actually administering the vaccine. But yeah, I guess details will be forthcoming. Any other questions? And I know that was a lot of information that I just spewed out at you. But that's the main summaries from all these articles that I read. So if you want to go back to something, it should be in one of these articles. Okay, if there are no other questions, let's see, Janine said, I had to pop in and out, so might have missed this, but has anything been updated about potential travel overseas? I do not think so. I think the consensus is still don't. And I mean, I think the government has said don't travel for Thanksgiving, but and the holidays. So even just overseas, I think even within the States, people are still saying it's better, it's more advisable to not. And let's see, Jennifer said side effects. So side effects have been headaches, joint pain, fever. I don't remember the exact percentages of people who had like mild side effects to like severe side effects, but it was very small. It was either like 1 or 2% who had severe side effects. So I think one of the articles I included was what it was like to participate in the clinical trial. So there's a little bit more information there about side effects. But it didn't seem like there was anything super serious that had come up. Okay, if there are other questions, please do feel free to put those into the chat box and we can come back to those. But let's go ahead and move on to the Montana Shared Catalog app. So I'll hand it over to Kylie and Rebecca to take it away for this.
Thanks, Amelia. This is Kylie McGregor. I'm the trainer for the Montana Shared Catalog Consortium, and we just want to let you know, if you haven't heard already, that the consortium now has an app for our patrons. So if your library is a member of the MSC consortium, then your patrons can download this app for free from the App Store or the Google Play Store. We also have promotional materials that I will give you the link for shortly, which include messages to post on social media, images, and that QR code which you can scan that will immediately take you to the app so that you can download it. And Amelia, if you wouldn't mind going to the next slide, please. Great. So here's just a starting list of what you can do with the app. You can look up your library's hours, location, and contact info. You can also, once you're logged in, manage your account, look at your checkouts, renew overdue items, place holds, and view your fines. Right now, patrons can't pay fines through the app, but we'll keep you posted on that development. You can also link to multiple accounts. So this is great, serves kind of like a family card. If mom has her account set up, she can also link to the kids' accounts or her partner's account. And then when you're logged in, you can kind of scroll through those barcodes on your phone. So if you forget to have the card with you and the library has the right kind of scanner for it, you can actually just scan your phone in the moment. You can also search your library's catalog. So that's like your physical collection, but you can also go to Montana Library to Go or the School Overdrive collection and search there. You can even view items that you check out from either Montana Library to Go or the School Overdrive in your browser through the app, although we still recommend keeping the Libby app or the Sora app on your phone for a more customized viewing experience. And then finally, if your library is interested in getting a customizable template, which is it costs a little bit more money, then you'll have extra functionality, like when your users sign into the app, they'll see your library's logo. You can add your own content in the tabs, like a link to your website or announcements. And they'll also have the option to do self-check with their phone. So that's pretty neat. And then the next page is just a list of links to the launch kit that I talked about with the promotional materials, as well as instructions on how to do the most common tasks in the app. And then I don't know if I said this, the app is called, the technical term is BC Mobile, but we're just calling it the Montana Shared Catalog app for the most part. Rebecca and I recently did an online fall workshop session on how to use BC Mobile and mobile staff, which is a mobile app specifically for staff to use. But yeah.
I just wanted to jump in and say that if you are interested in a library template, either for customizing or the option for self-check, please go ahead and open a help desk ticket so that we can work on getting a quote for you.
Thanks, Rebecca. I just shared the links to the promotional kit, the tasks, and our recording on Vimeo. But I am going to pull up a link if you would like to submit a ticket, just to make it easier for you guys. And if you have any questions about the app or feedback from your patrons, please open a ticket and let us know. We love to hear from you.
Awesome. Thanks, Kylie. Thanks, Rebecca.
Yeah, thanks for having us.
There was a
There is-
question from, oh, maybe you were about to say the same thing, Amelia.
Go for
There's
it.
a question from Susie. Can we sign up for the mobile template at a later date if we don't sign up right now? And yes, absolutely.
Awesome. Thanks so much again, Kylie and Rebecca. This is super cool. And we should rate I'll rate it 5 stars. I don't know if that's the rating system that is used on Google Play or whatever, but
Suzanne says she's loving it, so that's a good enough endorsement for me.
2 thumbs up from Suzanne Reimer. All right.
Thanks, Amelia.
Yeah, thank you. Let's see. So we are actually at the end of our agenda for today. I included a picture of pumpkins because they're just fun and round and cheery. I just listened actually to an Ologies podcast episode about pumpkins. The study of pumpkins apparently is called cucurbitology, I believe. So very fun. And we'll go ahead and end with our 3 deep breaths, but please do feel free to stay on and ask any questions, bring up any topics or comments afterwards, and we can, of course, discuss more. But so that we all leave with a little bit of Zen in our lives. Again, kind of sit up straight, pretend someone is kind of bringing your shoulders down, kind of pushing your upper back a little up, and we'll do our 3 deep breaths. So inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Perfect. All right, so I will end the recording here. Thank you again.